Hi everybody, my name's Susie Bailey, author of Healthy Body, Healthy Weight, Healthy Mind in 5 Easy Steps. And I'm here today to talk to you about genes, and not to worry if you have the genes that make you susceptible to getting a long-term chronic disorder, because you don't need to worry. Here's my book. Shall I show you? Here it is. There. Oh, it's probably back to front. Okay. My degree was in human and medical genetics, and until recently, I would have said the same thing as doctors would say to their patients, which is, if you have something like a disorder that's created by your genes, whereby your immune system is attacking your body, then I would have said the same as your doctor, in that, well, I'm sorry, there's nothing you can do about it. It will probably get worse. You can manage it with the drugs, but there's nothing that we can do. And I would have said that until now. A couple of years ago, as some of you all know, I started my research. I looked at the science because my mum was very ill, and the medicine that she was taking was not helping. And in fact, she was getting worse. She was deteriorating. So I read 3,000 research papers and came up with what looked like a solution. And you can read about it in the book, but it worked. She's now fine, and that's fantastic. Her depression's gone. Just to tell you, she's not depressed, she's not anxious. Her thyroid antibodies have reduced from hundreds into tens, so she's not attacking her thyroid gland anymore. And she's great. She's fit and healthy and great. So just to get back to the genes though, so people may have said, well, you've got the genes that make you susceptible to something. But what I learned during my research was that although, yes, we do have our genes and that they're not going to alter unless they mutate, and there's nothing we can do about that, there's something called epigenetics. Epi means above, genetics, genes. So it's another layer on top of your genes, which actually affects the way that your genes give their final message, if you like. So for example, it can turn them on or off. So that can mean that you get a disease or you don't get a disease, in very simple terms. It's more complex than that, but basically that's the sort of thing that it does. I realised during my research that what we do on a daily level, what we eat, what we drink, what we put on our skin, what we shampoo our hair with, what we wash our clothes with, all speaks to our DNA in the form of epigenetics. It can actually change our DNA from disease-giving to health-giving. And in my book, I explain how. It's really easy, it's simple, you can do it. You can get to the point where working with your doctor, I always say work with your doctor, don't self-diagnose, go to your doctor, work with them. You can hopefully reduce your medication and may even come off your medication altogether. It's possible. There's so much scientific evidence out there to show that's the case. Even with things like multiple sclerosis, you can reverse. It's possible to reverse. If things get to such a degree that organs are destroyed, then no. But yeah, if you catch it before things are destroyed, then yes, things can be reversed, and there's the science there that shows it. My book will tell you how, in 5 easy steps, you can change your DNA from disease-giving to health-giving. It's easy and you can do it. Thank you. See you soon. Bye.